Doctor, coming to heart attacks, are there any warning signs and symptoms that one should look out for, to know that they're going to have a heart attack?
Now we see that no age is immune to heart attack. So heart attack can happen even in 20s and 30s. So if you have this at your back of mind, then it doesn't become difficult for you to get diagnosed with heart problem. Now those people who come towards us, 25% of them, they overreact. They come with unusual chest discomfort, thinking that it is a heart related problem. It is all because of the half knowledge. We need to make them understand what are the classic symptoms of the heart attack. They should understand what actually is the presentation of the heart attack. Those people who get chest pain onto one side, which can be pointed out with one pointer or one finger onto the left side, maybe heart is chiefly onto left side, they get panicky about that issue and they feel that this is arising from heart. They rush to the hospital emergency department. It is 99.9% not related to heart. Pinprick sensation, pricky, stabby pain onto the left side where heart is located, that area pain is definitely not because of the heart. Now, what is this heart attack pain or what is this heart related discomfort? The discomfort which is arising at the center of the chest is chiefly related to heart. Plus, if in addition to that, if you feel suffocated, if you feel that you are not at ease, you are getting your breath a little heavier, so heaviness of breath, breathlessness, or in medical word it is called dyspnea, difficulty in breathing, this can be heart related issue 99.9% unless it is investigated and told to you that it is not heart related or it is psychological or hysterical presentation. Now, to diagnose a heart patient with a heart problem correctly, we need to get some battery of investigations done. Sometimes your heart attack pain, which is a forerunner of the heart attack, that is called angina, might not lead to any abnormality in your ECG or electrocardiogram, might not lead to any abnormality in your blood parameter study, or even for that matter in advanced studies like echocardiography. In such situations, we need to do sequential ECG, sequential blood titers, get sequential echo screening. Then we might have to subject this individual to treadmill test or stress test, or for that matter directly for angiographies depending on the symptom presentation. So central heaviness with suffocation, especially when you are climbing uphill, moving hurriedly to catch up train or bus, or trying to catch up with your job place hurriedly, this heaviness which comes up is angina definitely. Now, major population fits into stable angina, like pain comes, discomfort comes and goes. When you rest, relax, when you ease out, sit, relax, it goes off. In some individual, this pain comes up when you are sitting, when you are not doing a job which is a physically challenging job. This discomfort, that is angina, is called unstable angina. Means here there is no effort which is causing or adding on to the risk of development of angina. These people are having more chances of development of heart attack. So these unstable patients or people need to be treated more aggressively, like they should be subjected for angiogram as early as possible, and if need with an angioplasty or for the subsequent therapy, CAB, bypass surgery or medical management should be given to them. Some people don't have classy symptoms. They are the unlucky ones. Now, who all will not have classy symptoms, especially female gender? Very sorry to say, but female in India still is a neglected population. The lady or a woman who looks after the household chores, she doesn't have outing, she neglects her heart pain, she gets poor diet, she gets poor attention, her complaints are overlooked, and to so much effect that actual angina or heart related discomfort is also overlooked as a digestion problem, indigestion, muscular pain. Female gender, women, they develop more complex heart disorder by the time they reach hospital because they are neglected. Now, those who are diabetics, they develop atypical symptoms. They might develop just profuse sweating. They might fall totally unconscious, sometimes giving a premonition that only sugar has dropped. People just load them with sugar, give them high sugar content drinks or some sweeteners. With the sugar rise, they feel that a person is going to get okay, but they don't actually come to understand that the person might be having heart attack problem or heart related issue also. So silent problem. Sometimes we in investigation find that patients already have had a heart attack based on ECG, based on echocardiography, and go into the depth of the history. Don't get any classical history of chest pain, of cardiac origin. Sometimes they just get a gassy discomfort. They take a stroll on the in the veranda or on the terrace or in the open area. Then that pain, it subsides, because once the heart muscles are damaged, over 1 hour's time they get permanently damaged. And it is said rightly that dead never cry. So dead muscles, they don't cry, they don't give you pain, discomfort. People come in the late stage with the silent disorder progressing to a condition called heart failure, where they have boggy, swollen legs, where they have a lot of retention of fluid, so a lot of water accumulation in the body. This is called heart failure. In this situation, treatment becomes very difficult, because the treatment has to be aimed at not only heart failure, but treatment of the cause. Sometimes treatment of the cause doesn't become so easy, and they have already developed irreversible or irreparable disorder. So silent heart problems, this is a major challenge to us in cardiology segment, because they progress rapidly towards heart failure, and by that time we miss the bus.
For more such information related to your health, log on to health.india.com.